We are a community, and so professionals working with consumers together towards living healthy.
I'm a blind gay man living with mental illness and AIDS. I'm living with major depression with psychotic features and AIDS. I was able to learn that I'm a good advocate for other people through CHARG. All around, it's been a lifesaver for me.
When you walk in the door, you're greeted by a consumer that comes here, and you connect with them and you hear about their day, or they've tried something, like they rode the bus somewhere for the first time and they're really successful, or just hearing about all their accomplishments. Some of them are small steps to us, but they're big steps for them.
The drop-in center is a place where anybody that's living with mental illness and in treatment or seeking treatment can come in and they can either just hang out if they want to and watch TV or listen to the stereo or just hang out, or we get different activities throughout the week there. They're going to start an art group in a couple of weeks on Monday afternoons, different activities and different outings that we do, and people can take advantage of those if they want. It's up to the person what they want to do. I spent over almost 20 years looking for work. I dispatched private ambulances here in Denver back in the early 80s. Lost my last job in early 83 and spent a lot of years looking for work and just couldn't get it and would fall into such deep depressions that nobody had diagnosed. Another thing we're very proud of is our consumer employment program. Those of us that are in the consumer employment program, we do part-time jobs, receptionists, custodial, and some clerical and stuff, but it gives us as consumers a little bit more income over our disability. The consumer board is all mental health consumers. We function just like a regular nonprofit board, but we function in concert with the Heart board. I feel like being on the board, I'm more empowered to be knowing what's going on. As a board member, I get to see where the money is coming from and where it's going, and what's being done here, and how we are responding to our consumers and stuff. It is very empowering. I find it to be very helpful for me. Back in 2004, I had to have my left knee replaced. I went out in February of 2004. For about 4 months, I wasn't able to get around real well. I was barely able to make it into work, and I wasn't able to come in for my therapy. So what happened? So I didn't have 4 months without therapy. Stephanie came to my apartment and we did therapy at home. You don't see that anywhere else.
CHARG runs on a really kind of a shoestring tight budget, and without the support of foundations and individual donors and community members and churches and other types of groups, it would be difficult to continue here at CHARG.
CHARG is a good place for people with mental illness to gain control of their lives and with the support and caring that they need. And it's a place where we are welcoming to people and work together to make our lives better. That's all what we're all about, is to make the mental health consumers' lives better.